let's begin first. What precisely can you tell us about this case, and that can help update our viewers and also help them follow with precautions, sir?
We got this gentleman admitted in our hospital 2 days back, and this particular patient had a history of fever 10 days back, and then he had a skin lesion typical of monkeypox. He had typical vesicular and vesicopustular lesion in the lower limb, thighs, thorax, abdomen, over the face, and also on the palms. So we had a high level of suspicion that he might be having monkeypox.
Yes.
We sent the skin scraping and skin sample to the National Institute of Virology, Pune, along with the blood test. And today we got the report that he is positive. Right now patient is stable, his vital parameters are well, and he is recovering. But we have seen the first case after we have the alert from Kerala that first case was detected in Kerala. We had a high level meeting, and Delhi government given us the direction to prepare an isolation and treatment facility. We have trained our doctors, resident staff, nurses, paramedics that if any patient...
Dr. Suresh, what you're telling us is very important, because you are the doctor who is currently taking care of that patient, and I'm glad to know that he's recovering. I'll just come back to you, sir, because we'll connect that and correct that audio line. There seems to be some issue with it. Please stay on. I request my producers to arrange that. But Dr. Goel, what he's also saying is very important. It started from Kerala, and this Delhi case actually had no travel history outside the country. And this has been, as it appears, a domestic issue. So how are we looking at the infection of it and the fatality aspect of it? Is this fatal? Because everyone has their alarm now up. Is there a strain in any country that is proving to be deadly here? What would you want to tell the viewer right now about the fatality aspect of monkeypox specifically?
See, again, these are early days, but as it is, monkeypox causes a very mild disease and very rarely fatal. And so far as I understand, around 16,000 cases have been reported worldwide in 75 countries. Only 5 cases have died. So, it is not as serious or as complicated disease as the COVID has been. So again, I said these are early days and there is nothing to be panicked about. But yes, this sets an alarm because, India is not an endemic country. So from where this patient has got the infection. So now this is the time when the public health measures have to be intensified, our surveillance has to be, intensified. And if one case is there who is diagnosed, it means there are other cases around who might have, escaped through that, surveillance, and maybe another source of infection. So whatever close contacts who have been in, who have come in contact with him, any person who's come in contact with him must be, thoroughly investigated.
But we can establish, doctor, that this is clearly an infectious disease. So anyone, if has been in contact with the individual, or the individual has caught it, that everyone else around must stay away, and this the patient needs to be in isolation. That is what is definitely sorted for an update of anyone listening to you right now.
Yes.
So, and also can you explain that, are we looking at, may it not happen, but are we looking at any sort of a lockdown like the COVID pandemic, or that's too early to say right now?
At all, because see, it is the infectiousness is very, very limited. It's not as infectious COVID is, and the patient has to be symptomatic. Like in COVID, the asymptomatic individuals could also could spread the infection, but here it is not the case. So person has to be, symptomatic. So you would know the person who is symptomatic can easily be isolated. So isolation also becomes easier. And plus we have the vaccines which are available. Of course, they have not been proven in this endemic currently, but those vaccines which were effective against the smallpox could be effective against this infection also. And some medicines are already available which are effective against smallpox, can also be used against this monkeypox virus. So there is nothing to be worried, but it doesn't mean that we become lackadaisical. We don't look into it, because it can cause serious morbidities. It can cause skin rashes and can cause permanent defacement of the areas. So one has to be careful.
Dr. Goel, please continue to stay with us.